Hi, my name is Wes Hayden, President and co-founder of CoachCare. In this video, we will dive deep to explain how health systems and physician groups can add over $1 million of monthly revenue and improve patient outcomes in 3 months without adding staff or chasing new patients. So here are some examples of healthcare organizations having success. Here you can see our client CoreLife, a fast-growing national physician group, grew their remote patient monitoring program from zero to nearly $100,000 in monthly revenue with almost 500 patients. Similarly, here you can see our client, the Herndon Center, a large physician center of excellence, grew its remote patient monitoring program from zero to over 17,000 in monthly revenue with nearly 100 patients. So you can really extrapolate that into how that could have an impact for your business as well. But along with these proven results, there are also significant market tailwinds. So CMS has recently expanded its support for RPM services in line with the broader transition to value-based care. This is evidenced by the 2021 fee schedule, which was kept reimbursements in line with 2020 at a time when reimbursements for many other services decreased. And the fee schedule also increased flexibility for providers to utilize RPM by allowing them to utilize auxiliary staff and to support additional diagnoses. So this makes RPM even easier to implement and generate robust reimbursement, both with Medicare and with commercial payers. And you can learn more about this by looking at the fee schedule and commentary on the CMS website. So who is this for? Well, this video is for you if you're a health system or physician group leader that needs to add substantial revenue to your organization and you're trying to build a best-in-class patient care program that you can be proud of. This information is for you in that case. If you've tried to launch new services and gotten frustrated by all the bureaucracy, you're not the only one. This is for you also. And if you look ahead and are concerned about the financial prospects for your organization, then this is also for you. If you feel like you and your team work hard every day, but you just can't seem to help patients enough, then this is for you. And if you think your patients deserve better care than just an annual visit, then this is also for you. And lastly, if you are concerned with the continuing reductions in insurance payouts for your life-saving services and are frustrated that ancillary services and products just don't pay off, then this is for you. This is not for you, though, if you don't accept insurance in the US, don't have just a few hours to invest up front, or are not comfortable with new technology, then this is not for you. So the core concept here is that there are game-changing ways to double your revenue without adding even a single new patient. Physicians and their staff, as you probably know, are constrained by time and resources, so they have to use those well. They are challenged to really move the needle on revenue growth because the traditional approach of adding new patients, it just isn't scalable. And we all know you can add revenue to your organization by attracting new patients. However, adding these patients is expensive and it puts pressure on already overwhelmed staff. It's not scalable because the maximum number of patients you can see is limited by the number of hours you work in a day. And if you had to add a lot of new patients, you have to add a lot of new patients really to have any meaningful impact on your revenue. So for more than 7 years, all we have done is help physicians generate more revenue with existing patients and existing staff fast. So just a little bit of background on CoachCare. For those who don't know me, my name is Wes Hayden. My co-founder, Andrew Zangalowski, and I started our company in 2013, following careers as private equity investors in New York, where we saw the challenges faced by healthcare providers working to grow revenue and patient care in the face of increasing costs. And we actually started our business as a virtual care solution for patients with chronic conditions, and originally built all of our technology to serve the needs of our clinical staff that were serving those patients. So we knew that this type of proactive monitoring was beneficial to the patients, even though those services weren't reimbursed at the time. So, we take great pride in the positive impact we've had on the individuals we treated. However, we recognized, after a few years of that we were not exceptional clinic administrators. We recognized that our core competency was providing the technology to support our other providers and their patients. And so we transitioned really to focus solely on the technology. And since then, we've refined and improved our technology with thousands of health systems, physician groups, and practices, hundreds of thousands of providers and patients throughout the US and internationally. We've also raised venture capital funding from some great healthcare-focused funds like Clee Capital and Stonehenge Growth Equity. And just kind of furthering that effort, the move towards value-based care and remote care in recent years has really created new opportunities. to support providers there. So fortunately, we feel pretty well positioned since we built the technology tools and team to support this type of remote care. And today, we're just proud that we've been able to drive strong claim success rates and really help achieve substantial revenue and ROI for many of our clients. And look, I think we're really proud of the awards we've received and the thousands of clients and partners we've brought on over the past 7 years. You can see just a few of those examples here of some of our clients and partners, some large health systems and physician groups that we work with and other partner organizations. So let's walk through the activities you need to do to achieve the significant increase in revenue and improvement in patient care that I noted earlier. So first, get paid more for each patient while improving their care for all patients through remote patient monitoring, or as we'll term it, RPM. So the old way to increase revenue was by trying to bring in new patients with marketing, directory listings, or referrals from other physicians. But as we talked about, marketing to new patients is expensive and it's time consuming. And even in the best case, you can't add much more than about 10% to your top line due to just staff capacity. So you spend a lot of time and money and you don't get many new patients. And unless you have a world-class in-house marketing team and top-tier agencies, most of that marketing spend is unfortunately going to be wasted. So after spending tens of thousands of dollars, you may add a few patients and then realize that you can't scale further, again, due to that staff capacity. So what's the better way here? Well, the better way is to prescribe reimbursable RPM treatments for your existing as well as new chronic, at-risk, and post-acute patients, which is likely the majority of your patients. You can generate substantial new revenue from your existing patient population while avoiding that wasted spend inherent in marketing. This also drastically improves the efficacy of your treatments because you have this information on patients in between their visits. And you can watch as patients get and stay excited about their care, healthier as a result of this effort. But also, the important aspect is around staff as well. You can get your staff focused on value-added activities and improve morale as a result because you're doing good while also doing well. And then also, what we see here is that you're able to fill some underutilized or under-reimbursed junior staff time by using this type of periodic monitoring to fit into the schedule and improve patients' progress. So the core insight of this activity is that pushing your organization to patient capacity may constrain your business, not accelerate it. So for each new patient you bring on, you incur direct and indirect costs. As staff feel more and more overwhelmed, the quality of care necessarily declines for every patient as time per patient declines and staff morale crumbles. So earning more revenue per patient actually has the opposite, right? You can make more money without chasing new patients, allowing you to provide better care and maintain satisfied, high-functioning staff as a result. So here's just an example how you can see with even fewer patients, an organization can dramatically increase revenues through RPM. And look, the bottom line here is you can generate double the revenue with half the patients. And also keep in mind, imagine how much less stressed your team will be as a result of that. The economic and the morale and the outcomes impact is substantial. So let's go over a few questions that commonly come up with this type of activity. So, first off, why shouldn't I overwhelm my organization with every patient I can find, right? Usually practices and programs at all sizes are looking to grow patients. Well, as we talked about, doing so, it necessarily impairs the quality of care because you're forced to spend less time with each patient to move on to the next. And in addition, this leads to long, stressful days and overworked, dissatisfied staff. Can I take advantage of these services with my current staff? Yes, absolutely. So your current staff can use underutilized time to deliver these services. And this is an area we focus on a lot with clients, is that whether it's on admin days or between other visits or even during missed visits, this type of monitoring can be done very flexibly with the time that is available. And in addition, since you're not overwhelming your organization, your existing staff will have the capacity to focus on this patient care, including RPM. And then lastly, common question. New services are hard to implement. How is this any different? Well, that's the thing is RPM is not an entirely new or different, medical procedure or new drug or anything like that. It doesn't require any new medical equipment. It doesn't require any additional space in your facilities. In fact, the crux of it is you and your staff are likely providing some of these services already, but you're just not getting paid for them. So monitoring a patient while they follow your treatment plan to ensure they're improving, it's common sense, right, for patients and providers. So RPM is easy to explain on both sides of that interaction. And in addition, much of the effort around this is handled automatically by the software, right? You get that leverage there. And then lastly, as far as the implementation, kind of the upfront training, this is typically only a few hours of time to go over billing and clinical training. Because as we said, it's really quite easy to explain because it's common sense. So now let's talk about our next key activity. You need to monitor patients and proactively target those that need the care most. So let's look at an example of the old way of treating patients, right? After an appointment, you wish your patient well, they schedule a follow-up, in months to come, maybe 6, 12 months out. And when they come back, we fast forward there, you rush to review their chart before sitting down with them for 5 minutes and, maybe make a little adjustment to the medication. And then, rinse and repeat, right? So your interaction with patients is infrequently, occurring there. So you only learn about new or worsening medical issues when patients come into your facilities, or, unfortunately, in some cases, when they're taken to the emergency room. Not the best outcome there. So what's the better way? Well, the better way is for patients to transmit this key vital information to you in real time from home. And you can have your junior staff reimbursed for periodically reviewing that data and then alerting you if data falls outside of predefined healthy ranges. And so in addition to billing for this data collection and this time, your staff was able to quickly identify and respond to patient needs and prevent urgent medical situations. So this ultimately allows you to proactively engage with patients that need your help right away, not months later or when they go to the emergency room. And again, not to mention the positive impact that has on morale and staff workload when they can do things proactively versus at the last minute in an urgent situation. So again, the core concept of this, core insight of this activity is that the greatest impact you can make on a patient care is actually in between visits. And I know that might sound counterintuitive, but you need to know when patients need help and what they need as efficiently as possible. And at the end of the day, 99.9% of the time, patients are not in your office. So I'll just use an example, getting a blood pressure measurement once per year. That's not enough to diagnose someone who might have hypertension. It can lead to a misdiagnosis. So getting the right data at the right time allows you to better care for patients. And payers have finally woken up to this fact and will reimburse you well for monitoring patients. And we've got an example here, link on the slide from one of the payers. So, let me go back to that example of blood pressure. Here's a real-time example of a real patient. For this patient, you can see on the left-hand side here that at the doctor's office, the patient's blood pressure was in the healthy range. However, when you look at the multiple readings from home on different days and at different times over multiple months, you show that it consistently at a much higher elevated level. So if it were not for this remote monitoring capability, this patient would have been misdiagnosed for almost a year. And who knows, could have had some adverse event happen in the meantime. So again, monitoring patients from home allows physicians to respond early to changes in patient health while getting paid for the service. So this is the third and last key activity. Make sure you get paid. So let's look at the old way of that. The old way is to rely on your staff to figure out how to deliver and build new RPM services on their own. And as a result, you probably get paid less than you should because of denied claims. You don't understand all the technical nuances of administering them. And also you're waiting forever for payments because of delayed and denied claims and so forth. But there is a better way. The better way is to rely on an expert to train and shepherd your staff from delivery to cash collection. So you get up the learning curve quickly and you get paid without the frustration of denied and delayed claims. So the core insight of this activity is that getting reimbursed for RPM, it is easy when you know what to do. RPM is a new service. It has specific requirements, to be fair. But an RPM expert can easily explain the right steps to deliver and to bill it. And so here's an example of just the kind of the comparison of working with an expert versus just relying on your own staff to try and learn a new service. At the end of the day, again, billing insurance isn't difficult, but it is process and detail oriented. And so using already proven best practices and documentation templates, relying on experts that are already up the learning curve, it ensures that you are paid the full amount you deserve. So look, to summarize, here's the game-changing method to increase revenue. All you need to do is implement RPM monitoring services, monitor your patients, and rely on experts to make sure you get paid for that work. And at the end of the day, then you'll collect over $1 million per month and improve your patient outcomes in just 3 months without having to add staff or new patients. It's that simple. So now you might be asking, how do we go about that? Well, there are two ways really to increase your revenue this way using RPM. So let's look at the hard way, right? Well, the hard way is you can spend millions of dollars and years developing a remote patient monitoring platform from scratch, and that includes software, it includes mobile apps for patients, connected devices that you need. And look, this technology is complex and it will require 6 to 8 specialized employees and significant attention from senior business and clinical staff. So that's a lot of time and money. But as I mentioned before, there is a better way. So the better way is you can work with CoachCare and launch your fully customized remote monitoring solution in just a couple months and then start submitting claims right away. So to reiterate, this is for health systems and physician groups who need to add substantial revenue and improve patient care in their organizations without having to add staff or chasing new patients. So again, here are some examples of the many healthcare organizations that have used us to dramatically increase revenue and improve patient outcomes in just a few months here without the new staff or the new patients. So I mentioned before, our client CoreLife, very fast-growing national physician group, mainly focused on chronic conditions. Today they're supporting over 30 locations in a number of states and over 250,000 patients. And if you look at their trajectory here, you can see how CoreLife grew their remote patient monitoring program with us from zero to nearly $100,000 in monthly revenue with almost 500 patients. And we're continuing to grow that program together today. And here's just a little quick quote from the RPM lead there, just highlighting the success of our partnership. Again, very, very proud of what we've done there together. And also here's our client, the Herndon Reed Center. So, I mentioned this group, a large physician center of excellence focused around weight management, but, drives referrals from numerous different specialties. And they're supporting thousands of patients across Northern California. And to look at their trajectory as well, you can see how Herndon Reed grew their remote patient monitoring program from zero to over 17,000 in monthly revenue with nearly 100 patients. And again, their program continues to grow every month. And also here are a few examples of testimonials from other clients of all sizes, health systems, hospitals, independent practices. And I think the point is you can really take some of these revenue numbers we shared and extrapolate them for your patient population, because we've seen this work at all sizes. So along with this proof from all of our clients, I would like to reemphasize the broader regulatory and market support for RPM. So as we mentioned, CMS has expanded its support for RPM services in line with this transition to value-based care. And this is evidenced by the 2021 fee schedule, which kept the reimbursements in line with 2020 at a time when many other services were having declines in their reimbursements. And just the increased flexibility that we saw for providers to utilize RPM by allowing them to use auxiliary staff and support additional diagnoses, pretty much any diagnosis really. This really makes RPM even easier to implement and to generate robust reimbursement, both with Medicare and commercial payers. And so, again, you can see the proof of this support on the CMS website and just real tailwinds here in the years going forward. And similarly, you can look at numerous credible industry publications highlighting the growth in RPM. At the end of the day, the utilization of RPM is really expanding rapidly. So it is estimated that currently nearly 88% of healthcare organizations are currently or intend to invest and or consider RPM technologies. That is the vast majority. And look, we're still early in the growth of RPM tools, but the momentum is really picking up here. So here's what's going to happen when you work with us. You can expect to add $1 million or more of monthly revenue within 3 months. This will be high margin revenue because there's low cost to implement and deliver RPM. You will be able to achieve the better patient outcomes that you have been seeking perhaps for your entire career. And you can finally get rid of that wasted marketing spend that we talked about and the processes designed to push patients through as fast as possible at the expense of quality care. You can forget about the overwhelmed staff and the morale issues. Look, ultimately you'll feel fulfilled because you'll be doing good for your patients while doing well for your business. And lastly, you'll finally be able to stop thinking about the financial pressure in your organization that so many of us have been experiencing with the pandemic recently, because you'll have your solution there. And so how does it all work then? Well, before, when you wanted to add revenue to your organization, you'd have to spend a significant amount of time and money up front to market to new patients. And this did not always result in more revenue, right? Like we talked about. But now you can use CoachCare's award-winning RPM platform, including a custom branded patient mobile app, provider web dashboard that pairs with our proprietary connected scale, blood pressure cuff, glucose monitor, and pulse oximeter. And all those things work together to meet the requirements for RPM billing. So this enables you to generate significant revenue without the big upfront investment in time and money. Also, Before, you never had the data to identify and intervene with patients between consultations. So when vitals or other biometrics dictated they needed help, you didn't have that information in front of you. You had to wait until they come back into the office for their next appointment, which could be months and months later. And as we know, this frequently leads to a condition progressively worsening and, unfortunately, in the worst cases, emergency room visits. But now you can use our real-time health tracking and automated alerts to remotely monitor and proactively target patients for intervention without needing to add staff. These features make you immediately aware of problems. And also, you can use our additional telehealth suite of tools, video calling and so forth, to allow you to address them with patients directly before they become worse. And then, look, lastly, I think before, if you wanted to get paid for RPM on your own, you'd have to rely on your own staff to figure out how to do this, right? How do they deliver it? How do they build these services? They may not have the experience with these new services, and it could result in a slower ramp or no ramp, lower reimbursements, frustration all around. As we've talked about. But now you can use our automated time tracking, our detailed billing reports, our on-call AHIMA and AAPC certified billing experts to quickly train your staff, significantly increase the amount of money you collect, and minimize your audit risk in the meantime. So if you see here, our detailed billing report ensures both that your clinical staff is delivering all the services required to submit claims so that you don't miss out on any revenue. But it also makes sure that the claim submission process is incredibly fast and accurate because we're tracking all of that for you automatically. And just to emphasize that point further, for example, here's a profile of one of our billing experts, Sherry. You can see her experience here on the left-hand side, multiple AAPC certifications, years of billing and RPM experience. Our RPM billing experts specialize in delivering and billing these specific services and also have the experience and perspective of advocating for our clients across hundreds of payers, which further increases our success rate. So our RPM billing experts work directly with CMS and with other payers and have even convinced payers to start covering RPM for the first time. So there's a lot of value there to help advocate for your cause as a result. And at the end of the day, these features and services combine to make sure you collect what you're owed. And just here's another testimonial to highlight the positive impact our billing experts have had for our clients here. So I'm sure that the question is, what does it all cost, right? Well, if you wanted to implement RPM on your own, you'd need to spend more than $5 million up front over 18 months to build all these components and at least $1 million per year to maintain them, right? Software is dynamic. There's ongoing work required. People often forget that. But at the end of the day, our offering costs a small fraction of that. And here's what you get, with that offering. You get a custom branded app for your patients to input the data that's needed for RPM and connect the devices that we provide. You get a web dashboard for your providers to monitor this data on the other side of the interaction. You get our connected scale, our blood pressure cuff, our glucometer, our pulse oximeter. All those are available to provide valuable, objective data from patients' home. And then along with that, you get a variety of automated learning tools to let you know when patients are at risk, might be in need of an intervention. You get a full suite of telehealth tools to interact with patients in the interaction of in the sense where you have an intervention that's needed. And then you get the complete RPM tracking and reporting tools that I was just alluding to earlier to avoid all that manual work. So we track the time for you, we track the eligibility, we notify patients when they need to use their devices and so forth. We do all of that for you. And then lastly, of course, our team of on-demand RPM billing experts to assist you every step of the way and ensure you get paid what you deserve. So instead of paying $5 million up front and millions annually to maintain an RPM platform, you can license our proven technology for a small fraction of the cost. So we charge a small base license fee of $600 per month, plus $30 for each patient you remotely monitor for RPM reimbursement. And just keep in mind that RPM reimbursements average about $150 per patient per month. So our fees are a very small proportion of your reimbursement there. So to get started, all you need to do is book a 15-minute Q&A session with us to see how much revenue you can make with RPM. And there's a link to book a call alongside this video. Now, I also want to make you aware of a few other considerations that come up. So first is, let's discuss timing. So as you probably know by now, we take a hands-on approach with all of our clients. We know how to successfully onboard patients and maximize your claims reimbursements. We will train your staff as much as needed and literally submit and reconcile claims with your biller. But this commitment requires significant time from our team. So therefore, we only accept the most qualified and committed new clients. In fact, we'll ask you to sign a statement of commitment during our implementation. But because of this time we invest, we only engage in 5 new implementations per month. So it's important that you make a decision quickly so we're able to work with you. And just remember, you're losing money every day that you delay here. And of course, look, our RPM fees are contingent on your success, and they're backed up with a guarantee. So if you don't receive any of the reimbursement we just talked about, you get your RPM fees back. We only get paid when you get paid. So to summarize this offer for you here, you'll receive the following: the full-featured remote patient monitoring platform, including custom-branded mobile app, provider dashboard, connected devices, all of our automated alerting, our escalation tracking, telehealth suite, time tracking tools, on-demand expert support, and given our commitment to each of our clients and the time we invest to maximize these reimbursements for you, we can only work on 5 implementations per month. And as I said, if you don't receive any of that reimbursement, then our RPM fees are credited back to you. We only get paid if you get paid. So to get started, again, all you need to do is schedule a 15-minute Q&A and tour of our technology. I'll answer all your questions about RPM, and together we'll calculate how much you can make by implementing RPM. So again, there's a link to book a call alongside this video, and thank you for your time. Now, I will answer some commonly asked questions about our offer. So why is RPM reimbursed across all specialties? Well, RPM is useful to monitor any condition outside the office, which ultimately prevents adverse outcomes. So, it can be used to support both acute and chronic conditions across specialties. It's just important that you have a connected device that provides data that's relevant to those conditions. So if you have a patient with hypertension, then they need a blood pressure cuff, for example. Next here we have, why do nearly all payers cover RPM? Well, as we talked about, CMS is highly supportive of RPM as it's proven to reduce overall healthcare costs. And most commercial payers have taken CMS's lead by instituting RPM, and more added each year. So reimbursement rates are strong, eligibility has expanded, and there's just a broader range of providers that are now able to deliver these services, which is really great. Why are reimbursement rates so high? Well, payers want providers to deliver these services ultimately. And they want you to deliver those services because they are less costly than hospital admissions or other complications that can occur. I don't need it. Well, if you don't need more revenue, you're a very lucky person. I'll just leave it at that. I don't think I can afford it. Well, the upfront costs are minimal, and all of the RPM fees are contingent on your success, meaning you have to generate revenue in order to pay any of those fees. So we would be happy to provide a profitability calculator that we've used very well with many of our clients, and have that discussion with whomever has budget authority or organization. Maybe schedule a brief call with them, just walk through everything from the revenue to the fully loaded costs, everything included, and then look at what the profit looks like there. What if I don't have time? Well, look, it really takes very little time. 2 or 3 hours of training max, and the entire program can be run by your office manager or another staff lead. So one of the benefits here is that physicians can really delegate a lot of this to other members of their team. They don't have to, have this, bear the burden of this. And as a physician, all you really need to do is order the services at the beginning of the month and then sign off with them at the end of the month so they can be billed. Can I trust you? Very deep question here. Well, you've seen some of our testimonials and case studies so far. But look, I'd be happy to provide a direct reference to prove our value and credibility to you. So we can talk about that in our Q&A discussion. Are there any long-term contracts? Well, we do have an annual agreement for our base license, and that's really because we spend a lot of time customizing and configuring this specifically for your program, for your specialty, for your department. But just keep in mind, for many clients, this cost is actually covered by one of our partner companies. And I've alluded to that in other videos. We have a variety of partner companies, medical device companies, nutrition product companies that can cover that cost for you. But also, look, we believe it is important to have some small upfront investment to ensure you and your organization are serious about successfully implementing our solution. We want to make sure everyone has some skin in the game. A competitor has a lower price. Why should I work with you? Well, look, what I always tell clients is the most expensive vendor is the one that doesn't get you paid. They're far more costly in the long term. And as we've talked about, making sure that you get paid, that you get reimbursed successfully, that's a core focus, and it's an area of pride for us, given the expert support that we provide to ensure that. So at the end of the day, like I said, most expensive vendor is the one that doesn't get you paid. Can I take advantage of RPM even if I don't want my own staff to deliver it? Yes, you can actually. So we have an outsourced provider partner who can deliver RPM based on your referrals. So even less work for you and your team. You can literally hand that off. Very easy. Will this work outside the US? So RPM is specific to US insurers, and so it will not work outside the US. But we do offer a virtual health product that enables you to utilize our solution for other purposes. We've included a link here that you can look at that on our website. What if some of my payers do not cover it? Well, Medicare covers these services nationally, so just get that out of the way. But we've also directly pre-verified coverage by over 100 commercial payers in over 30 states. So it's unlikely that your payers do not cover RPM at all. Look, and we'll pre-verify this for you for your specific payers before we get started. But if we find that they do not cover, then look, we'll actually advocate directly with the medical director of that payer to help implement an RPM policy. We've had success with that approach in the past. And then look, ultimately, if some of your patients can't utilize this because their payer doesn't cover it, that's okay. If it works for even a small proportion of your patients, it's still a very profitable endeavor, and certainly helps patient outcomes, as we talked about. Does this work in my state? Yes. Medicare covers these services nationally, and we have directly pre-verified coverage by over 100 commercial payers in over 30 states. In fact, we have not yet encountered a state where there is no commercial coverage. So it is covered to some degree. Are reimbursement rates good in my state? Well, Medicare reimbursement rates are set by region and are adjusted for cost of living, so they will vary. And then commercial payers, they typically follow these Medicare adjustments we found, but you can look up your actual RPM reimbursement rates by contacting your payers, or also we're happy to pre-verify those rates for you. When we can talk about that on your Q&A call. What if a patient doesn't have a smartphone or tablet to connect to the RPM device? Very good question. So the fact of the matter is 85% of American adults have a smartphone, and that includes the majority of elderly people. However, look, if a patient doesn't have a smartphone or tablet, they can also use the device of a caregiver or family member for RPM. We find that works well in many cases. But as I said, the vast majority of people do actually have these devices. What about the bureaucracy at my health system or physician group? They take a long time to approve services like this. Good question, particularly in the larger health system and physician group space. Well, look, we have all the necessary security and other information to fulfill the vendor vetting for your health system or physician group. We've done it many times, and we can work directly with your IT or other teams to complete this process, so it does not take your time. We do recommend, however, having a senior champion who can help push this process through if there are ever bureaucratic delays. But we'll do everything we can, and we have a lot of experience really minimizing that bureaucratic work for you. Are the RPM rules very clear? I've heard different interpretations and opinions. Good point. Yes, they are clear if you know what you're doing and have the right sources of knowledge. So that is the benefit of our RPM billing experts. But we also have direct insight and clarity from contacts at CMS and commercial payers. So we're hearing it from the proverbial horse's mouth. And so it really gives us a lot of confidence that our approach is the right approach. You have a monthly fee and a competitor that does not. Why should I work? So some RPM vendors have no upfront fees. But we believe it is important to have some small upfront investment to ensure that you and your organization are serious about successfully implementing our solution. And at the end of the day, if you really look at the numbers in the long term, we're usually more profitable for you. Does this work if we use outsourced billers? Yes, it does. It works with both outsourced and in-house billers. And our RPM billing experts will guide them either way, if it's in-house or outsourced. Can I ramp up quickly if I have a big team? Yes, as long as multiple staff members can train at once. So we've trained up to 30 staff at once. So that really works well to cover one specialty at a time, to do each specialty in their own training, for example. But yes, we can ramp up quickly with a big team. Now is not a good time. Well, look, we hear that sometimes, and I get where you're coming from because there's a lot going on. But before you make a decision, just remember how much revenue you can gain over that period of time by starting now. So let me just ask you this simple question. What else are you doing now that will add over $1 million of revenue per month? I currently work with another company to deliver RPM. Okay, I understand. So let's just look at what has worked well and what has not worked well with that company. We have a variety of case studies that we've highlighted that you can find testimonials showing how much more revenue you can generate working with us and the ways that we do that. And so just compare that to what you've experienced already. Do you do EHR integration? Yes, we do, as long as the opportunity is large enough to justify the additional technology development work. So typically this is reserved for health systems and physician groups. And just keep in mind, there are also other ways we can share data with your EHR even without an integration. So that concludes the Q&A section. Thank you for your time. And again, please feel free to schedule a 15-minute Q&A session to learn how much revenue you can generate with RPM. Again, this is Wes Hayden, and thank you for your time.